It's your eye health experts, Prevent Blindness Texas, and welcome to Eyespiring, a conversation about all things vision and life.
Hi, and welcome to our episode of Eyespiring. I'm Heather Patrick, the CEO of Prevent Blindness Texas, and your host. PBT is a public health agency focused on vision and eye health. We serve the entire state, and our goal is to make sure everybody knows and understands why vision is important and how it connects to your overall health. I am super excited about today's guest. I have known Layla for how long now? A couple of years. And what I will say is her passion, her dedication, but her ability to use her voice to take action, I think is pretty phenomenal. And so we're going to talk a little bit about that, all things eye health, and why it's important to have these conversations. So I'll give you a little bit about Dr. Lohmann, but then I'm going to give it to her to really give the ins and outs. But she's a mom of two, a wife, a practicing dentist, and the co-founder and clinical director of Apex Dental Partners, one of the fastest growing, and I love this part, people-centered dental support organizations. At 12, she was diagnosed with Graves' disease. More than 20 years later, during her first pregnancy, she learned she had thyroid eye disease. Over the past 10 years, she has expanded her advocacy and professional leadership, and she has really used her voice to make a difference in this space, in women's health, obviously in the dental world. But she believes education is empowerment, and so does PBT. And so let's dive in. Dr. Layla Lohmann, tell us a little bit more about you.
Well, you already said everything. I'm done. Podcast over. No.
That's it.
Thank you so much for that glowing introduction. For those of you listening, this Eyespiring podcast is something near and dear to my heart, living with a chronic health issue that has no cure. And I really appreciate what organizations like Prevent Blindness does for people that may not have that strong voice or confidence to have their stories being told, because vulnerability is sometimes seen as a weakness, when in reality, sharing and connecting makes you more powerful, because the ripple effect about conversations and creating that safe space to have those conversations is just inspiring and eye-spiring. So a little bit about me. I'm a mom of two. I am a wife, a practicing clinician, as well as clinical director for Apex Dental Partners. But many of those hats are not who I am. And one of the things that I found most important in women advocacy, and honestly just patient advocacy in general, is you lose sense of who you are when your conditions start becoming active or flare-ups, or maybe you fear judgment for being thoughtful about how you want to live your boundaries. And I have found the more that you can be authentic and true to yourself, you have this liberating feeling that you don't have that burden to be who people expect you to be, but you actually hold yourself to that accountability. So what I love about what you're doing and my position at Prevent Blindness was I didn't realize how important my voice was, because I was self-conscious about my condition. And even as I'm looking in this podcast right now, I notice my eyes are two different shapes and I'm judging myself and all these things. And the thing is you live with these conditions and you have to manage them different ways. So I'm just excited to be able to share my story and continue to be the voice that maybe some others can't be. And hopefully it connects with you, and then you feel safe enough to share your story.
I love that. And for me, one of the biggest pieces about, I think, this business is connection. And really, I think just across human beings. But the longer I do this, the more important it is to drive connection, especially for our patients and clients that are questioning, should I use my voice? Can I use my voice? Will it matter? And the answer is yes. Yes, it does.
But the thing is about mattering is depending on what your expectation is.
Yeah.
If your expectation is they're going to make a difference, well, what does a difference look like for you?
Yeah.
If it's connecting with another person so they don't feel alone, I think sharing your story is going to be super impactful.
Yeah.
I think the collective voice of what PBT does and organization does is make an effective change from a legislative standpoint, as well as impacting places where I can't be. So I think that's what's important about what you're doing and what we do together is absolutely connection's important, but the collective voice and being able to support that collective voice has been one of the reasons why I've been an advocate of PBT Texas and prevent blindness in general, is everyone deserves the right to see, and the oral space, everyone deserves the right to have a healthy mouth.
Yeah.
But sometimes the access to it is challenging, and honestly, I can't fix that in 5 minutes.
Yeah.
I can do a lot in 5 minutes with a conversation and sharing, and that's why sharing your voices and your story is so important.
Yeah. Agreed. All right. So let's jump in. You were first diagnosed with Graves' disease at 12 years old. What do you remember about that?
Oh my gosh, that one's a tough one. You start with a toughie. Um, I'm 41 right now, and I will say, looking back and reflecting on who I was at 12, an Iranian American, I'm a twin. Parents, were trying to just do what they can and not knowing what the condition was. Honestly, I was just on a roller coaster and didn't know that I was on it. So at 12, I didn't really have the words or the insight to be a voice that felt safe enough. I just did what people told me. I did what my doctors told me. I did what my mom told me. So if I were to give advice to a future 12-year-old living with a
Mhm.
chronic health condition, would be take a minute to talk about what you're afraid of. People called me lazy to not want to go play outside because I didn't know how to articulate that the sun hurt my eyes all the time because I didn't know that was my condition.
Right.
So my thought is be able to talk about those things. And 12-year-old me, um, probably wish someone would have listened to why I didn't want to go outside
Yeah.
instead of feeling judged that I was lazy all the time.
Yeah. So do you think in this day and age that's changed for children? Do you think that we've done a better job, maybe overall, to help them? Or do you think that's one of the areas we still need to work on?
I think we've improved. I think the way parenting and trying to reset the cycle of letting emotions be open.
Mhm.
But then you go to that where you're like, well, now everything's emotional. So there's just that balance that I think that we still could work on, and not having that victim mindset. And one of the things, my son lives with chronic health issues and he's 10. So I really relate to him, although he thinks I'm 100 years old. So it's funny.
That my son does too. My son thinks I'm 100 years old too.
It's so funny because I'm like, Lucas, I promise you in 2 years, I was you living with a condition. So we need to understand, I need you to build this stamina and resilience. And it's not easy. I'm asking you to build this at 10, but you have support. So I
Yeah.
think the challenge is you have to be living with a condition and being vulnerable enough to talk to your kids about it
Yeah.
versus managing it, minimizing it, and making it just being like, that's fine, it's fine, I'm fine, it's okay. It's okay
Yeah.
to say I'm not okay and still be productive.
Yeah. It's a
So I
great
think,
point.
yeah, I think we're doing better.
Yeah. How did your understanding of your condition change when you later were diagnosed with thyroid eye disease during your first pregnancy?
Honestly, I was frustrated at first
Mhm.
because I thought I fixed it with the
Mhm.
thyroidectomy. I think the shock that I now have another one. I think I had some grief that I had to go through. So
Mhm.
Prevent Blindness had this art therapy program that I got into, and it was really nice because it was accessible to anybody. I didn't have to pay for anything other than my time. And so I think understanding my condition now has been eye-opening to advocate for myself. To even this day, one of the challenges I have with my spouse is we've been together for 21 years. He still will say something like, hey, like let's go outside more with the kids. And I'm like, okay. So I think understanding it helps me be able to articulate a way that's saying like, Understood. I'm not doing well today, so let's do 15 minutes, and it doesn't feel like I'm not doing enough at times because I've built the skills to be able to advocate for myself instead of feeling a destructive thought pathway.
Hmm. So how did you get there? How did you bridge that gap to be able to, have that sense of communication, right? To be able to talk about it in that way of saying, no, I can only do this and be okay with that. How'd you get there?
That is such a loaded question, but I will try to be concise.
Hey, we've got all day.
Um, fabulous. Um, Honestly, it's been a journey of self-discovery, of awareness that sometimes the miscommunication was I was a barrier to conversations because I was fearing judgment, fear of speaking out, fear of making really hard decisions. And fear is something that I've learned that there's an acronym I heard that's like face everything and rise, or fear everything and run.
Yeah.
And I think one of the best tools that I did was invest time in learning when I am part of the problem, and being humbled by, I'm a recovering people pleaser. And you had to like go through this process of like, why am I pleasing people? And there's a lot of healing that has to happen in your past. But a lot of neuroscience is saying like your beliefs are distorting your reality. And if you're not aware that you're distorting this reality, miscommunication happens. So I went through this journey after COVID, of my medication being unavailable due to the COVID vaccine, which is what led me to the pathway of patient advocacy. Luckily, in my shoes, I was a healthcare provider, so I already was in the healthcare space of helping people in an aspect, but this was more of a personal thing. And I think art therapy really helped align me to take out all of the heavy weight of what I was holding in because of that fear, and then I put it out on paper. I drew stick figures, man. I felt like when I was doing this first, I was like, don't judge me. And then I started really being open of like, screw it. Like, I don't have to like judge anybody. And honestly, I think I was judging myself. Like, I wasn't
Yeah.
giving myself the same grace I gave my best friends. So I went through this journey of inward and outward mindset, a 16-hour course. I invested time in learning where my roadblocks were and disc communication. I learned my
Mhm.
communication style and how I always expected everyone to understand me. Well, Heather, I'm okay being misunderstood. So I think I started accepting that Layla is human and God gave me grace. And why am I not giving myself grace every
Yeah.
day? And so I built this arsenal in my head, and I'm committed to being my own best friend every day. And
Yeah.
that's what's been great. It's still tough. I still get pushback left and right. And going back to old version of her feels comfortable, but I remember the weight of that elephant on my chest when I wasn't this version to advocate, conversate, and not be adversarial. So when people now ask me questions, I say, don't get offended or defensive. This is all internal. And then I just
Right.
get curious. Help me understand. Are you trying to be mean to me right now?
I do like so it's interesting because throughout, especially the last 2 years, I've gone through a health coaching program and then worked with an executive coach. And um, the whole idea of getting curious, right? It really does change the whole conversation. Um, I'm really learning to listen. We all think we're good listeners, um, but we're not.
You're listening to respond.
Yeah.
And so you naturally are like, I'm going to answer this.
Hmm.
But when you actually get out of your own head as a recovering overthinker, to your point, I've gone to therapy for 10 years, over 10 years. I've done executive coaching. I've been open to receiving constructive feedback. And when I get destructive feedback, I check it in my head. I mean, like they're coming from a place of constructive. They just don't know how to communicate well. So now I can get curious of saying, with it's my business or my patients, or
Yeah.
someone tells me I did something wrong, I innately Layla's reactions coming, and I'm like, no, reflect and respond. And like this takes me less time in my head because I'm committed to being this person.
Yeah.
To your point, I feel like sometimes we don't give ourselves that time to say, I don't need to be the expert at everything. I'm going to take a minute and think about it. And if that person has a problem with it, they better tell me that. I don't need to create a problem. I need to get curious and see, is there even a problem here?
Yeah. Yeah.
And I think it's the same way with patient advocacy when there's misunderstandings with patient-doctor relationships. If you don't care if they have great bedside manner, but they're great at their skill set, that's an expectation you better have a conversation
Right.
about.
Yeah.
If you want that fluffy, sweet best friend, then you have to have that expectation that that's the results that you're going to get to. So I think the dynamic works also with stop feeling like they're telling you, but get curious. And then if they get offended that you're not taking their prescribed care,
Yeah.
ask them why are they frustrated with you. You don't understand why this is there.
Right.
And honestly, the top three things why people have a barrier to care is usually cost, comfort, or fear of discomfort, and then their condition. They're mad that they have it.
Yep. Yep. All right. So, what do you think are some common misconceptions about thyroid eye disease or Graves' disease?
It's funny you asked that. I was just having a conversation with my kid in the car, and I said, imagine having sand or an eyelash in your eye. And then I said, how does that feel? And they're like, it hurts. And I said, well, imagine living with that every day and you still have to go on and be okay with it. And my son goes, well, that's sad.
Mhm.
And I said, yeah. I said, he goes, I thought your eyes just tear up, and I thought this, and I thought that. And I think that sometimes is hard to being like, you want them to understand you, but you also need to figure out how to manage it yourself.
Mhm.
I don't know if that answered your question, but it, it,
So, what questions over the years? So, when you've shared you have Graves' disease or that you have thyroid eye disease, what do people, what do they respond with? Or what have they
oh,
asked you about that you're like, wow, that's what, like, you really like, people, they don't know. And so,
yeah, they usually ask me like, oh, just use eye drops. And
really,
or yeah, they'll be like, oh, I use this all the time. And so I think the misconception of thyroid eye disease is they don't see that I internalize what I look like every day because I feel disfigured. And it's not their job to do that. It's honestly, that's unfair to put that burden on family and friends to like just know what it feels like. Well, they don't. They don't live with this. They probably live with some other condition that you can connect with.
yeah,
So I think the misconception is why are your eyes so big? Like, I mean, I get told all the time, like you have not right now, but when I'm in a severe flare, like it
yeah,
scares people. And my daughter was like, "Your eye is so red," and I'm like, "I know, girl. Today
yeah,
is not a great day." I get it. Um, I don't know that. Oh, that like like a thyroid hyperthyroidism is connected completely with thyroid eye disease when they could be two separate conditions. People tell you in any condition, to stop feeling stressed. I'm like,
yeah.
thank you so much for that. Um, I don't know about the misconceptions. I think living with it so long, I manage and minimize it too.
Yeah, yeah, yeah. So, what do you wish someone would have told you earlier in this journey?
Good question. I think that you're not alone,
Mm,
and because it feels lonely when you live it, especially when you're in a space where you don't see it.
yeah.
But it's one of those things. I was just talking to a patient the other day, and she's 36 years old, has cancer. It's super breast cancer, and it's super aggressive. And she's like, you don't even ask to get mammograms till you're 40. And so I wish someone would have told me that learning about a condition does not mean that your life is going to be destroyed,
Mm,
but that you can figure out a way to live with it and still be super successful, but you're just going to have to manage things different. I was talking to a mentee about his ADHD. And so I think the more that we can say, I'm telling you, you have this condition. Here's what we can do to help you manage the condition.
mhm,
You also have to do some of the work.
yeah.
My doctor told me to put eye drops in like 7 times a day. I'm not going to do that. There's no way that every time I talk to somebody, I'm going to put it in there. So I have to be okay with having pain in my eyes because I'm not doing what the doctor is prescribing because it doesn't work with my quality of life. So I think maybe managing my expectations at a younger age might have been a better approach of what I'm saying. I'm trying to think of like, what would I like my expectations? No one's going to understand it other than someone who lives with it. So why do you
Yeah.
expect people to? But have a conversation and say, like, I just don't feel okay right now. I can't go outside with the kids and
Yeah.
be okay accepting that disappointment happens.
Mm, that's a good phrase. Disappointment happens. But that's true. But that's true in most things when you're dealing with something with a chronic disease, right?
Right.
It is, I mean, I think that goes back to the people pleasing too, right?
Yeah.
I mean, the reality is, and this is what I love about talking to you, right? You've gotten to that place in life, and it goes back to what you said earlier, right? You are authentic. I know what my life is. I want to give you this. Will you receive it? Right? I mean, that really is, and I love that about you. And I think that's an important part. But I do think it is part of the journey, right?
Yeah.
And I think for so many people, they want to go on that journey. They don't know how to go on the journey, and that's why I hope conversations like this and organizations like mine, right, help people get connected to have support to go on those journeys.
That's right. Like when you ask me, like, how did you get here? I chose to take action to change my circumstances into choices.
Yeah.
So every day I choose to, and I know a lot of people say it like gratitude, but I'm like, I am grateful that today it's not a very bad day. And then so then I can go and do what I need to do and then have that boundary. But I choose to take action each day. And if people in my life don't accept that, they weren't going to accept me anyways. And so I'm okay releasing that from, my boundaries.
Yeah.
It's scary and it's actually really uncomfortable. I was telling one of my colleagues, when I have that uncomfortable feeling now, I'm like, oh, that's great, Layla, because you're improving. That uncomfortable feeling helps you keep building that resilience. When before, when I felt uncomfortable, I shied away from everything because I was judging myself, I was judging others. I didn't even mean to do it, right? It goes in your head
Yeah.
and you're just like, I'm just going to sit back and be quiet. They're
Yeah.
judging. Like, and
Yeah.
now like I'm not going to do that anymore. And if this is all that we are, is we're acquaintances, or in my professional career, you're no longer a patient of mine. I accept that. And I think that you have to build the skills and take the time to invest in some type of community, leadership training, disc coaching. People get frustrated that it costs money to get health coaches. Okay, well, it's a job.
Yeah.
I need to support my family just like you do, but things that you do is free. But like if you need that extra step, you need to prioritize that care, which means you have to budget for it.
Yeah. Yeah. Or take the time to work with organization like ours, right? That can help connect you to the resources because
Yeah.
we know not everybody can afford it, even if it is a priority for them. But
Mhm.
that's why organizations like ours exist too, right? But I mean, sometimes you
100%.
you have to do the research to find us. Or hopefully we've done such a great job of talking about who we are, what we do, that enough people know who we are.
Well, they also have to attend these things. Like they also have to invest the time to be out of their own head and actually be listening to receive the information.
Mhm.
So if one person sees this podcast and just says, you know what, I just want someone to hear me, like go into the community and just get a friend for a minute and then be the person you need to be. I don't compete with other people anymore. That's the recovery part of people pleasing is I compete with myself to be the best version of my day, and I do not operate from shame or blame anymore. If I feel myself being pulled under, like, shovel putting, yourself and you're
Yeah.
just feeling down,
Yeah.
if I start recognizing I'm feeling that in any situation, I take a minute and reflect, and I don't respond to anybody, and I have to ask myself why. And it's typically a past trauma, a past judgment. And then I'm already having this distorted reality because I'm in my own head. So I have to stop and take a minute and reflect. And it's very challenging, especially with your personal relationships, to do that
Yeah.
because you're worried they're judging you. And they
Can
probably
you
are.
get to that place where, oh, well, if they are.
I mean, like that's the thing is like I accept like I would say 18 months ago, I accept being misunderstood. And now
Yeah.
I just get curious about what I said was confusing. And then you talk to your husband and he's like, everything. I'm like, oh, well, I'm not in a place to have a conversation right now. So let's just watch a movie.
All right. So let's kind of move into that bridging the connection between your professional life and managing chronic disease. And so, as a dentist, how did your own eye disease change the way you think about whole body health?
Oh my gosh, it's been a game changer for both my patients and
Mhm,
cathartic to myself.
mhm,
I've been able to even have a more powerful conversation because everything in the plaque in the mouth can transfer to other places. So the oral plaque transfers up and down. It's actually being associated with macular degeneration, Alzheimer's, and then pancreatic cancers, and the normal cardiovascular, diabetes, and
yeah,
pregnancy. So what I've really honed in on is the whole body system is that if people don't know how to manage every aspect, they don't have to be an expert, but they have to know what they need to be doing at home to be able to have the quality of life that they want to have. And sometimes that quality choice is not great because you have a super uncomfortable chronic condition, like someone living with chronic pain all the time. Um, you still have to live your life. It starts getting very depressing. And so that's why you have to have investments in whether that's time or finances or resources of working with you is like it can get very dark living with chronic health diseases with no cure. And there's so many out there that I connect. My patients have this whole part of me that's like, I understand you're living with this or this or this, but I don't want this to be a contributing factor. So
right.
here's how we're going to manage this because this is my expertise. And then we can work with your other clinicians to figure out how to manage the other things. But I think they feel seen when it's not just fixing
Mm,
a tooth, but
right.
helping me holistically. And
Yeah.
I get told, no, I can't do it. I can't afford it all the time. And I say, that's not a problem. I'm here to fix it when it's a big problem. I'm just trying to be proactive to avoid that. But you
Yeah.
have to take some ownership of this. And I think bridging the gap between dynamic duo of the patient being powerful enough to have those conversations with clinicians feeling confident and competent that we can do it together, even if we disagree. I think that's a lost art. And that's what I'm trying to help bridge the gap between all the healthcare spaces is that
Yeah.
we're all connected. Literally, my whole body
Oh,
is connected.
yeah.
My,
Yeah.
my arm hurting, it gives me a headache, which then leads me to not want to do anything, which leads me to being depressed at home because I don't want to do anything a day. So, like, it's really just being open that I'm not going to be a victim. How do I stop being a victim? And then get curious, ask questions instead of getting on your own head. That's what helps me is like, I could call Heather and being like, hey, I'm having a really bad problem. Can you direct me to, actually, that's what I did.
I know.
I did. I did. I was like, they took my medication away. Like, how do I tell my voice? And you're like, here's some resources. You didn't fix the problem for me. You gave me an avenue to give to where I needed to go. And then it let me be the voice to do it. And so when we talk together, we find the connection of community, nonprofits, people doing it. If you can't be the voice, send me a message. And I promise you I'll help you on the right resource.
Yeah. Yep. So let's talk a little bit about that. It was you came to no, you reached out, right? Had a question because you were going through this challenge, and we connected you to the national office as well, which led you to the Aspect program. Okay.
Yes.
So talk a little bit about that, and then we'll come back on how we came full circle.
I love the Aspect program. So in 2020, when the whole vaccine came and the medication I was on had infusions had to be stopped because of the production of the vaccine, I got really frustrated because I finally felt what relief felt like after battling insurance and all the things. And so circumstances just didn't have my medication. So there was a gap in care. And I was just like, what is happening? And so I reached out to you.
Mhm.
You gave me the avenue, and then I got involved with the Aspect program,
Mhm.
and it really helped hone in the skills on how to be a patient advocate and the tool to help you be like elevator pitches. Half the time, my elevator pitch would be losing people because I'm like trying to tell them my condition plus this and having them this. It's like you were trying to give them 29 years of pain in like 4 seconds. What Aspect did was, who are you talking to? What is your audience? It really gave you a framework to be a better patient advocate. And the program paid you to do it. I got paid to be a better advocate, which is amazing. So they really try hard to help with advocacy because then it helps with legislation because it comes from a place of authenticity, but you're helping build people to be the professional advocates that we need to affect the bigger change because the impact is the story. It's the people living with it, it's the constituents living with it so that our people can then make change on a policy place. So I love Aspect.
Good. It drives home, right? It's hard to change something when you have no personal connection to it, right? And I think building patient advocates, right? One, it gives you the platform to have a voice,
Mhm.
right? But it also helps bridge that. It helps bridge the gap in knowledge, the gap in understanding, right?
Yeah,
When you have bombarded like our, legislators are with all that information, right? It is hard to know, okay, should we make this change or not, right? And so I think it is the opportunity, if nothing else, right, to give that personal understanding of this is what life looks like,
yeah,
right? And you have the ability to change it if you can, right?
yeah.
And this is why it matters. And I think that is really, I was in the cancer world for 11 years. And I've been in the chronic disease world, and then I've been in the vision space for almost a decade. And it's still crazy to me how, just like with oral health, it's still so disconnected, when in
Sure,
reality, to your point, it is all so interconnected. And
sure.
that is my hope that, within the next 3 5 years, the general public really understands how critical eye health is. It's not just about seeing, although clearly we want people to see, but it is truly, when they say it's a window to your soul, it's definitely a window to your health soul for sure.
For sure. And the great thing about that program was it helped me understand legislation and policy. I
Mhm.
came from a space of being frustrated with insurance and why people just can't help me. I pay for this. Why are you
Right,
not helping me? You're a roadblock to my care. And what Aspect did was like, it helped you understand, like, this is what it is. You can't change that. That is
right,
such a monster and that you can't change that. But the collective voice, the collective small wins ultimately gets a big win.
yeah,
And I do think part of the challenge is providers. Like when you talk about whole health, it's a little burdensome on a provider to being like, hey, it's all interconnected. And then a patient asks you a question and then you don't know the answer and then
yeah,
you lose credibility. When
right.
in reality, you don't. In reality, you can say, and I just talked to a patient today, she has a lot of chronic health issues. She had pain in her back and she was having jaw pain and she had to get off her anti-inflammatories and she just was thinking it was complete TMJ. She'd never had it before, been my patient for
Mhm.
5 years. And I really had to take a step back because it was a very challenging, complex case. And I had to go back and say, it sounds to me like it's the meds that you got off and it's reference pain. So let's wait until, and she's in excruciating pain, mind you, right?
Mhm.
Like, so I can't dismiss she's not
Right,
in pain. But there
right.
was no TMJ issue. And so I said, let's do this. When you have your procedure on Friday, let's circle back in 1 week after you're on the right medication because you didn't have that problem before. And then let's see if TMJ is part of your problem. But I became a provider from a holistic, proactive
Mhm.
approach. And most people are like, oh, that's the ophthalmologist's job. Oh, no, that's your cardiologist's job. And then the providers perpetuate the same problem. They're like, no, 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 that's your dentist. Like, how about we have a conversation so the patient feels heard? And I know from a fact when I call cardiologists, they're just like, why are you calling me? I'm like, oh, I'm sorry. Have you seen the new studies from 2000 that there's the biofilm in the mouth? That's probably why his blood pressure is not being accurately represented. And so I think part of the challenge that you can't really fight is the providers need to start stepping up and getting out of their inbox, like getting out of their own heads and say, like, this is a holistic approach. I may not have the answer to it. Give me your primary care doctor, your cardiologist, and we're going to circle back and connect and see how we can help you. And I don't think people prioritize that.
Yeah. Yeah. Part of what we talk about on a regular basis is how we help, again, bridge that divide, basically, especially between
Yeah.
primary care and the eyes.
Yeah.
Right. And I do think it is part of it too. Again, providers have so much, especially primary care providers, right? They have to
Oh,
know
yeah.
so much. But I think where a group like us really could be helpful is they know we're here, right? We
I
know
know.
they know we can be a resource to them and a resource to their clients and help bridge that gap.
Hey,
But we've also talked about how do we help providers learn more about just general eye health in
yeah.
particular so that they do feel more comfortable saying, hey, I think, you've got an eye issue. Let's
Yeah.
talk about that,
You
right?
guys do a
And
great
then
job
referring.
about connecting and bridging that gap through like symposiums and
Yeah,
education initiatives. It's
yeah,
that doctors have so many continuing educations out there that they're just like, I don't have the time. And so
yeah,
I think that you guys are like, how do we? And you guys do a great job with like the women's health symposium is the part that I'm a part of.
yeah,
And it's really trying to connect those dots from an educational standpoint from teaching the students.
yeah,
I think teaching the students that these are resources instead of trying to get the gray-haired old guys to do it, it's more of like, how do we start affecting change where there's the biggest impact? And it may not give me a ROI tomorrow. It's going
right,
to give me an ROI in 10 years when those providers not down say like, hey, join the community with Prevent Blindness. You're living with macular degeneration. They can connect you with people so you don't feel alone. That is a
yeah,
less than 15-second connection that could be a super impactful for the doctors to not feel burdened, to help that condition
yeah,
specifically emotionally. They help
yeah,
them prescribe their care, guide them on their prescribed care, but then emotionally they can connect with people who live with it and
yeah.
who work with you.
Yeah, I think that's a great point. So you go through the Aspect program, you learn all these great things, and then you connect back to us. And now you're one of our top volunteers. We love working with you. And you've been amazing to learn from too throughout the last several years. But I love your story of you came to us with an issue and we helped you, right? And
Hmm.
not in the way probably you thought it was going to land.
No, I wanted you to fix it. I wanted you to just be like, here's your medicine.
But it gave you, my hope is, and I think this is true, it gave you so much more than I think you thought you
For sure.
anticipated, right? And that's what I love. I love about this organization, but I love about the space too. It's, people don't know we're here, but once they do, right, they stay connected because we bring value to the table. But the
You
people that are part of this organization across the board are just phenomenal. They're just amazing.
You guys really do because I don't know if I've told you this before, but after we did the art therapy for thyroid eye disease, based on that program, it speared off the thyroid eye disease community
Mhm.
and the community builders, and I became one of 12 and multiple people to help build that specifically in that space. And so the connection actually, your impact is even bigger because now we have over 300 individuals living with thyroid eye disease and they get connected with people who live with it. And so like it is huge. I am so, honored and blessed to be again, I was frustrated by the email. I was like, why aren't you giving me my answers? I mean, full disclosure, I was like, I don't, seems hard. This seems like a lot of work. But to your point, it had to have happened that way because you can't do what you need to do. It's not your condition, it's not what you're living with, and
Mhm.
you can't fight some of these battles, but you can be a resource. And then now I'm in this connected group where we
Yeah,
do live with the same condition, and so we can connect and complain and move on and build this community. So it's like you built this beautiful baby, and then, your stepchild starts coming and building this, and it's actually bonus children is what I should have said.
Yep.
Bonus
Yep.
child.
Yep.
It's all about the words you use. And so it went even before that. So now I'm a thyroid eye disease community builder, and really just born to be an advocacy in the space. And luckily, they have that avenue as like I'm a healthcare provider in other areas, so I can help our community be more powerful to their patients. Because I'm like, this is what you should say to your provider. Like,
Yeah.
they have a problem with it, then tell them you're not the provider for me. Do you have any friends I can go see?
I do. I love that it keeps growing. And I think that's the really amazing thing, right? Is that it just has these arms and legs that, it just goes back to the connection, and it builds, it
Yeah,
amplifies the voices, and it provides that support. And I think I think that's the ultimate way to be successful, right? I
sure.
mean, you know, the vision space is broad, and there are a lot of things in it. And I think, not one organization is going to solve it all, but if we work together,
Yeah,
we certainly can get further in where we want to go.
I
And so
agree
I think
completely. I
that
mean,
is, yeah, that's the amazing part.
I
So
think inspiring people to share their voice and be who they need to be, and be so happy that they're successful instead of envious or jealous, and
yeah,
really just ask the questions like, what are you doing differently and how can I do that in my space?
yeah,
Really just helps expand. And like you said, I love the word amplify. That's actually what I'm like, if it's going to amplify and clarify what this year looks like, it's going to be easier for me to manifest what I want.
yeah,
But I love that because it's the ripple effect of sharing your story, connecting. And I wouldn't have done that if I didn't take the action to email you about being frustrated about something. So it's all about that connection. You're right.
yeah. And I think to your point too, just reach out. You never know what's going to happen. Even if it's in frustration, you never know who's going to be that person that gets you to the place you need to be or want to be. And so
Sure.
I think, right, just reach out. You never know.
Yeah, and I bet that's the thing that people misunderstand. They want it to happen, but never take the action.
Yeah.
You have to be the one to take that step forward to reach out. It's really about you taking that step and getting outside yourself, because I could have just lived with it and been mad at the whole world that they took my medicine away and just lived with it. And you have to take action, and
Yeah.
that's the only person who can do it. No one can
Yeah.
do it but you, but we
Yeah.
have the support and the resources and people like you and programs like yours and Aspect that want you to be successful. You have to invest the time and energy.
Yeah. Okay. So, what are the two takeaways, if audience remembers nothing else about our conversation, that you want them to have?
Oh, that is so hard. I like talking. Look, let me think for a second. Okay. If I were to say two takeaways,
Mhm.
is one, learn and join programs to help you amplify your voice, um, or find people who can connect you to that,
Mhm.
if you really want to affect change in your personal life. Number two is become aware of when you are a roadblock to the care that you need, or a barrier, a roadblock in your life that you're part of the problem. The Taylor Swift song,
Yeah.
I'm the problem, it's me. That level of awareness is so beautiful. Because sometimes I am the problem, but if I am aware I'm the problem, then my choice is an action or an inaction, and then I have control back. I have the power back, and I don't give it to other people.
Yeah. Yeah. That's good. Very good. All right. Well, it's been awesome, as our conversations usually are. Of course, we don't always share them with thousands of people, but today we are. But it's always good to talk to you, Layla. I love your insight. I love your passion. And I love hearing about your journey,
Thank you.
because I think it's not only for if you have thyroid eye disease, but really it's about life, right? It really is, learning how to walk through life differently.
Yeah.
And I think that resonates in all different ways with all different people. So thank you for sharing your story. I truly appreciate it.
Thank you for having me, Heather. And I hope everybody is inspired by this podcast.
I like it. I like it. And on that note, thank you everyone for listening today. As always, you can join the PBT family. You can volunteer. You can donate. You can get involved like Layla did. We are always excited to hear from you. And we always close with tell us what your vision is. Have a great day.